Hello, everybody. Today is September the 13th. Again, I can't remember where I left off. Anyway, if I didn't make you aware of last Tuesday, I had a rough day, if it was last Tuesday. Yeah, it was September the 5th. It was last Tuesday. My hair's a mess, so. Anyway, last Tuesday I went to the hospital for my early day, my chemo day. Left the lodge, drove over to the hospital. Got there, I felt fine. I walked into the elevator. I went up to the lab floor to get my labs done, and then after that I sit back in the waiting room, and then I wait for my nurse oncologist to review my labs to see if I'm actually able to get my chemo or not. So I went into the waiting room. I sat there, and it's like open glass windows that you can see into the atrium. So it's bright in there. So then I'm sitting there and I had my mask on, and I looked over, and something didn't feel right. Didn't feel right at all. So I kind of felt like I had sunspots in my eyes, and I couldn't see real well. And I'm like, I drove into the parking lot. Downstairs was dark. I don't remember looking into the sun anywhere. So I sat there for about 10 minutes, and then they called me to come in for my labs. I stood up to go get in there for my labs. Got in, sat down, and the nurse or phlebotomist asked me if I felt okay. I said, I have a little bit of a problem with my vision. I don't know what's going on. I said, it just happened. I don't know what happened, but it happened. I said, I kind of feel like I have, at least my left eye, I feel like there's something blocking me from seeing the upper part of my left eye. I said, and even my right eye doesn't feel completely right. I said, I'm having a hard time seeing. So she put the blood pressure cuff on my left arm. And before she even took my blood. And I was at 84/51. And she told me to take my mask off and start breathing normal. She got me some water. She called my nurse oncologist to come to the floor to see me. And she took my blood. And the nurse oncologist showed up, and the nurse oncologist said immediately to get him in a wheelchair and get him up to a floor and get him started on fluids as soon as possible. No chemo, just fluids. So she did. She got me upstairs, and I had to wait a little while to get the fluids, but they put me in an infusion room, and they started my fluids. I got one bag. They checked my pressure. Talked to the nurse oncologist. She told them to give me another bag of fluids. So I was there for 2 hours getting fluids. My nurse oncologist came upstairs. The nutritionist came in before my nurse oncologist got there. Evidently, I tipped the scales at 142 pounds, which kind of shocked me, but didn't, because I had some days where I just could not eat after my fourth chemo, even after my third. But the fourth was the big one. After the fourth chemo, I was waiting for that jolt I usually get from the dexamethasone and the Zofran and the fluids. So I was waiting to try to get out of there and get that urge to want to eat. I never had it again. I didn't get it the fourth time like I did the first, the second, and somewhat the third time. So I got out of there and I came back, and I was exhausted. I had a hard time getting any food in my mouth. Protein shakes, anything, I had a hard time. They want me to drink Ensure, which tastes disgusting to me. I like protein shakes, but good protein shakes. But nevertheless, I had a hard time that week, the 4th to 5th week. So then she's telling me about, you're going to have to get a feeding tube. If not, you're going to be in the hospital. And then my nurse oncologist came in, and she kind of said the same thing. I'm scheduling you for a feeding tube for next week. If you can stabilize your weight, you won't need it. At that point, I only had 9 treatments left of radiation. And basically I said, well, if I need it, I need it. I'll go to the appointment, but I will try to increase my calorie count. So I got out of there after the fluids. She insisted she's not giving me chemo anymore, at least not that day. And we're going to go from there, play it day by day and see what happens. When I started this, my actual oncologist, chemo oncologist, told me that the magic number is 5 with the chemo for head and neck cancer. I guess a lot of other cancers also. That's where all the trials are, and that's where all the answers are. So at least minimum of 5 treatments along with the radiation, 35 radiation treatments. So ultimately, the next day I went to see my radiation oncologist, and he was concerned. Now when I got there, I got on the scale, I was 153 pounds. And he asked me what I ate last night. And I told him after yesterday, I decided to try and increase my calorie count. I didn't know what I could eat. I decided to order a Domino's deep dish pan pizza with tomato chunks, onions and mushrooms, and ham on half. See if I can get it down. So I ordered it. I was able to eat 2 pieces. I got it down. They're like 300 some calories a piece. That was a start. He said, I don't care how many pieces of pizza you ate last night. I'm going to chalk up that 142 pounds to a miscalibrated scale because I don't think that that's possible. One way or another, I was at 153. So take it for what it's worth, I guess. Anyway, he had discussed with me that if I can manage to stabilize my weight and my calorie count, my calorie intake, I won't need the feeding tube. He thinks I could do it. I think I could do it. But nonetheless, I had a consultation with the gastroenterologist about the feeding tube, and he explained to me how it's not really that bad of a deal to get it. It's just another place for infection that I really don't want to hold. They put an 8mm hole in your stomach, and then they stick a scope down your throat and put it's basically like a peg that they put in there. I forget what you call it, but nevertheless, I just don't want it if I don't have to, if I can eat. So I ended up, met with that consultation. That doctor also insisted, or indicated that scale might have been off, being that I'm still 153. Now I started at 170 when I came down here. And even at 153, there's a considerable amount of weight loss. Some of that is muscle, because I have to be concerned about how many calories I burn, so I really can't work out. And, I try and do arms and shoulders and a little bit of chest here and there. But with the limited amount of calories that I'm getting in, less than 2,000, even now, I'm trying to get 2,000 a day. I started with, I have an app, it's called Cronometer, and you can put all your food in, it keeps track of your calories, protein, carbs, fat intake, everything. So I've been doing that ever since last week, and at least I'm keeping track, and I've been getting between 1,500 and 2,000 a day. Some days I get a little more than 2,000. That's what I need to do to sustain my weight for the next week or so, 2 weeks at least. And even when I get back home, I have to increase my calorie count. The big thing is my blood pressure. It has been up and down. I bought a blood pressure cuff, one of those electronic ones, to keep track of it back here at the lodge while I'm here. I also bought myself a scale so I can keep track of my weight here daily. I don't want to do it, either of them, too much and drive myself crazy. But I think it's important. And they both go to an app, so you can record them. It records them for you. And then when I go to the doctors, I can show them where my blood pressure was while I was home. But it's been in the 80s several times over the last week. 80s and 50s. I increased my sodium count quite a bit. That's one of the things I noticed on my labs that was down. And I was able to, I bought some potato chips, salty ones, and I bought some salted pistachios, which I like, and I keep them in the car. So this way, when I'm driving back and forth to the hospital, I can try to munch down on them, or if I'm driving home on the weekend, munch on them, and this way it'll give me a little bit of calories, but more for the sodium content. Sodium allows you to help your body to retain the water a little bit more instead of just drinking it and peeing it out. So I think that may have helped with my dehydration and with my blood pressure. I just have to continue to keep going in the direction I'm going. And so then anyway, so that was last week. This week, Monday, I had my radiation treatment, and I saw my radiation oncologist. He thinks I'm doing good. He said I'm doing really good. He's actually surprised that I'm getting the 2,000 calories now, and doesn't think I need the peg tube. And then he told me that he'd still like me to get that one more chemo to put me into the bracket where I need to be, into that niche where they find is the best place to be with the 35 radiation treatments and the minimum of 5 chemo treatment. So then I met with my nurse oncologist yesterday, and I told her that Dr. Lukens would like me to get one more chemo in. And she said, I would like to get you to get one more in too. Seems like you've stabilized your weight. You're not anorexic anymore. You're doing all the right things. You're getting enough water. You increased your sodium. You only have 8 radiation treatments left. And I said to her, well, I said, the question is my pressure. I said, do you think that my pressure is a result of the chemo, and will it ever come back? Or Dr. Lucan said I may need to see a cardiologist in the near future, but we need to get through all of this first. And she said, I'm not going to say that you won't need to see a cardiologist in the near future, but she said that the pressure is most likely due to the chemotherapy and the dehydration and the weight loss. This is what it does to you, is what she said. This is what it does to the human body. And it sucks, but it is the treatment that we have, at least for this particular cancer. And I said, well, then the question is do we wait until next week to do the chemo on my last week here, and then I just go home and deal with it? Or she said, I would like you to get it today, meaning yesterday. She said, this way, if there are any complications or any issues that need to be addressed before you go home, she said, you're not scheduled to see me next week. I'm going to make a special appointment for you. So this way, if you get your infusion today, next week, next Tuesday, you come see me. I can get your labs, review them, see where you stand. If you need fluids, I can give you fluids. And then at that point, you're only going to have a few days left of radiation, and then you'll be back home. So I had told her If you are in need of your car to be repaired, I can probably help you. But when it comes to this, you and Dr. Lupins know your business. And I have to trust you. And I do. So if you think I should get the other chemo and you think I should get it today, then I'll get it. So I went and I had my chemo yesterday. I got the dexamethasone, I got the Zofran, I got the chemo. I felt pretty good. I was able to come home and eat last night. Again, I got almost 2,000 calories yesterday. Woke up this morning and I had 2 pieces of peanut butter and jelly toast. Funny thing is, I can't even taste the jelly. Don't ask me why. I know it's the chemo, but it's sad that what it does to you. Your taste buds, your tongue, everything is just all messed up. It's been like that almost 7 weeks now. I know it's going to be that way for the next month or so. It just doesn't matter. Food is not enjoyable right now. Food is a job. That is a job. Just get it into my mouth and get it down my belly. No matter what it is. Trying to get as much protein as I can between the shakes. I will say, as I said before, the Ensure is not for me. I've had too many good protein shakes over the years to know when something's good and something's bad, and Ensure is not good. Yeah, it's high calories. Yeah, it's a high in protein. But there are 2 different types of shakes that I like, other than my regular protein shake, but it's very low in calorie. I will tell you, Fairlife has a fantastic protein shake out there now. It tastes good. Even with a bad tongue, it tastes better than most other ones. It's called Fairlife, and it's chocolate. They have different levels. You can get, I think I had a strawberry last week that I bought on the road, and it was 42 grams of protein. One shake. 1 12-ounce, or I think they're 12-ounce. 1 12-ounce shake. And it was high calorie. It was like 200 and some calories. Now the Ensure is like 300, 400 calories. It tastes like garbage. So I would rather drink 2 of those Fairlife a day. They're not cheap. They're expensive. They're probably like $4. If you get the 42 gram one, it's like $5 or $6 for a drink. But you know what? I would much rather pay for it and drink that than drink the Ensure and force myself to drink something that is gross. And then there's also another one that's called Shamrock. A little bit less grams of protein. Taste-wise, a step down from the Fairlife. But I think they're 30. They have chocolate and vanilla. They're the 2 that I was able to pick up locally. And I think they're like 28 or 30 grams of protein. But still, they're better than drinking the Ensure. So I would rather drink 2 of those as opposed to the Ensure. So that's that. So anyway, so then I went for my radiation again today. Today is Wednesday. I got done and I got back here. And I'm going to tell you that everything they told me from the beginning, that, week 4, 5, 6, 7 are going to take its toll on you with the radiation. I have not taken anything for pain in weeks. They gave me the Lyrica, 75 milligram I haven't had to start it. Haven't taken Tylenol or naproxen. I'm trying to deal with the pain as far out as I possibly can. If I need it, I will take it. I also have Oxy, which when they gouged the back of my throat out and took my tonsils out, it's hard not to grab that bottle and go for it. But when it comes to something like that, you have a choice. I don't like drugs. Not at all. So I toughed that out with Tylenol and naproxen. And I took the Tylenol and naproxen all the way up into my second or third week here. And I had some swelling, as I had previous videos. My throat felt like it was out to here and solid like a rock. Like I had two tennis balls stuffed in my underjaw. And I remember telling you about that skewer pain that I had. That was really the worst part about this whole thing. And that was back when I was getting Proton. And then magically, I talked to Dr. Lin and the tumor shrunk. A few days later, that ear pain went away, that skewer pain went away. And they had me on Lyrica, but I didn't need it. I took the Lyrica after that pain went away, because they said, oh, you're going to need it. You're going to need it. Well, the Lyrica, they gave me 75 milligrams for 2 days, twice a day, and then they upped me to 150. When they upped me to 150, I was almost bedridden. I was so lethargic and out of it and couldn't deal with anything. I still had to drive myself to and from the hospital. I was late for my appointments just about every day because I just couldn't function properly. And I just said, screw it. You know, I went home over the weekend and talked to Rose, and Rose was like, you can't do this. And I stopped it. And then I talked to him, and he gave me 75 milligrams. I said, give me the 75 milligrams. If I need to take anything, I'll try the 75, but I'm not doing 150 because I got to be able to function. And that had a lot to do with the fact that I lost weight over that period of time, because here at the lodge, you can't have food in your room. The only thing you have is water, nothing but water. So in order for me to eat, I would have to get out of bed, get dressed, go downstairs, make something in the kitchen, or if they had dinner, eat it, and then go back to bed. And there were days I just couldn't get out of bed, and I said, screw it, I'm not gonna eat, which wasn't good. I ended up at 142 pounds. But as of right now, the pain is starting to get a little bit worse the last few days. I'm not gonna lie. I'm gonna take the camera off and show you my neck. Over the last week and a half, I don't know if you can see it or not, the skin is burned right off. I'm using cocoa butter just about every hour or two. Palmer's cocoa butter. It's a skin softener, and you can see how my neck is kind of beat up a little bit. And the amount of weight loss that I had doesn't help. But all in all, I put the cocoa butter on there, and I put it on at night before I go to bed, and I just cake it on. I cake it on there and let it absorb in, and it takes the burning sensation away. Softens the skin a little bit. It just makes me feel a ton better. So my go-to is Palmer's cocoa butter. They tell you aloe or whatever, but the cocoa butter I really like, just to say, if I had to choose. So that's what I'm using. Inside my throat feels like a raisin. It's dry, and it's tender in there. Probably burnt a little bit. I had some sores on the back of my tongue last week, back of my mouth, especially on that left side. I have also lost hair in the back of my head. Let me show you that if I can. I don't know if you get a good view because I can't really see the back of my head from here, but this hair loss on the bottom there was hair there. It's gone because of the radiation and the proton. It burns the hair follicles off of there now. Is it going to come back? I don't know. I truly don't care because I usually do a fade anyway. And I have my hair real short. This is really long for me. The reason it's long is, number one, I don't know where to get my hair cut down here. But number two, I've lost so much weight, the mask doesn't fit me properly anymore. And I don't want to take even pardon the pun, but a hair off the back of my head because they had to do a reassessment scan because I had lost so much weight and that the mask doesn't fit me so good. And some of this burning on my neck, when they did the reason for the reassessment scan is, according to my doctor, he said, now that I've lost so much weight in my face and in my neck, giving me the same amount of radiation that I had back when I was heavier is burning the skin more. The skin takes a big brunt of that. So they reduced the amount of radiation that I'm getting, and they worked that back into the plan on Monday. As a matter of fact, that's when I first started the lesser of the radiation. So maybe this won't burn as much, I don't know. But they also tell me that it's a cumulative effect. As of now, I think I only have 6 or 7 treatments left, radiation treatments. That was my last chemo yesterday. They wanted me to get 7 overall. But when I talked to Beth yesterday, she had told me that one more, get you to that 5, and we'll quit there. So I'm just waiting out the next week. Hopefully no severe side effects from this chemo that I got yesterday. Right now I feel pretty good. I'm going to finish up my radiation. And when I met my doctor the other day, he scheduled me for my PET and CAT scan. And that'll be in January 4th, I think it is. They're going to do a CAT scan from basically my knees up to see if there's any cancer left in my body. I won't know until then. As I said, it was into my lymph nodes here. We were stage 3/4. And lymph nodes are the highway to the rest of my body, so I'm praying. I've been praying more in the last month and a half than I have in my entire life together, I think. So come January, I should know whether I'm cancer-free or not. And we'll have to wait until then. When I did discuss with the doctor last week, I was curious as if this whole thing was working. I know he can't tell me for sure but he did bring it up. He brought up this when they did the evaluation scan because of the mask, and he showed me where the tumor had shrunk. Thank God. It has shrunk quite a bit. He said, and it's always behind. And they did that scan on last Friday, the Friday before Labor Day. And basically, the way I see it is, if you could imagine, your throat is just, your esophagus is just 2 straight lines here, and everything in the center is open. What I had a camel's hump on this side that came out into my esophagus, and that was back in July when they did that scan. They did this scan, and the 2 lines are here, and there's no more hump. My throat's open, and over here where the tumor was, you can see there was a big round red line on the top of the scan, and he superimposed that with where it's at now, and it was much smaller. That's why that pain went away. It's no longer pressing on my eustachian tube for my ear. But the tumor's still there, and the rest of the radiation that I have left, along with, they say that up to 2 months after you're done, that radiation continues to keep working. And it continues to keep killing cancer cells along with the chemo. the reason why they have to wait 3 months or 2 months, whatever it is, before they can do a scan. So anyway, guys, I'm thankful to be where I'm at. I'm very thankful for everything that this hospital's done for me. Thankful for this place to lodge that has given me a place to stay for the last month and a half. I'm thankful for all the support I'm getting from my family. My girlfriend Rose, God bless her for everything she's done for me, and she's the reason I'm here. I would have been back in my hometown. I would have just gotten radiation and chemo back there. And not that people don't survive back there, but they end up sometimes with a lot more side effects because it's just radiation. The blended treatment that I got here with half proton and half radiation may have saved me some side effects. I don't know. Like I said, the radiation's rough. You can see what it did to me, and I've only had several treatments, you know. So 35 of just radiation may have been worse. Other than that, anybody else that's going through all of this, one more thing I'll say. My girlfriend is also a dental hygienist for 40 years. She knows her stuff. One thing she did get me that I think is helping, that might be a tip for everybody else that's out there that's going through this, or will be going through this. She had me prescribed Proton toothpaste for my teeth. It's a prescription you have to get from your dentist. That toothpaste is to help keep your teeth strong throughout this. I had to get dental clearance before I was even able to come down for the radiation and the proton. So when I got that, she got me the Proton. You don't want any problems with your teeth when this happens. You can't afford an infection. But anyway, so the Proton toothpaste is important. She also got me Biotine rinse. Now, some of the things that I read in the documents that they gave me were, don't use any, rinses that are, they want you to use a tablespoon of baking soda and a tablespoon of salt water mixed with a cup of water, and rinse before and after each meal, and throughout the day several times. And I do that. I do it. I've been doing them. I think that's what's keeping the pH balance down in my mouth. And it's also, those sores that were there aren't there as much. I can feel them, but they're not as strong as they were before. But what I have used the Biotine rinse for is nighttime. I have to keep a bottle of water with me just about everywhere I go. I'm not kidding. To wet my throat and my mouth. And at nighttime, sometimes, especially in the room, the air is very dry in here with the air conditioning on. And even with the windows open, it's been very tough. No matter what I do, the air is very dry and stagnant. So I even went and I bought myself a cool mist humidifier. I run that, and it doesn't seem to help that much. A little bit, I turn it on, turn it off, whatever. The Biotine rinse, after I brush my teeth at night, I rinse with the baking soda, salt water. Then I brush my teeth with the Proton. Then I go and I take the Biotine rinse, and I try and rinse and gargle with it, just a capful. And somehow, some way, it seems to help my throat a little bit better than if I don't use it. If I don't use it, I need to drink water. I'll be up 3-4 times a night taking sips of water because your throat just gets so dry. And that's from the radiation and the proton. Nothing you're going to be able to do about that. They explained that to me. But that's the most painful part of this right now. So, as of right now, let's leave it at that. Just to encourage you guys again, should you have to go through this, should you have to, unfortunately, go through all of this, the chemo and the radiation and the mask, and it's not fun, guys. It's not fun. But you have to be strong. You have to be positive. And you just have to buckle up your chin strap and keep moving forward if you want to survive. Because really there's no options. It's up to you, and you can do it. God bless you if you do. I'm almost there. And I'm praying for the best outcome I could possibly have. And I pray for you too. I don't care if you're 60 years old, 70 years old, 80 years old, or if you're what I see sometimes over here at the hospital, a little baby going in for radiation treatments. It's heartbreaking. Heartbreaking. God bless you all. And hopefully these videos will give some tips, some ideas, at least let you know what you're looking at. Because some of the videos that I watched, they were informative. I know my videos are longer, but I tried to be a little bit more informative than some of the other videos. I wish I had the time and the energy to make a video every day so I can explain to you every day what play by play, but I just feel like I need to help share this with someone because I was scared to death, and I found some videos on YouTube that were helpful. And I don't mean to scare anybody to death. I'm giving it the way it is. I saw some videos out there that a guy said by the time that we're getting towards the end of the radiation treatments, I begged them not to stop. I don't think I'm going to be there. Bring it on, man. Let's get them over with. That's my point. That's where I'm at. Let's get them over with and let's move to cancer free. That's my goal. That is my goal. As I have repeated multiple times, I am not Superman. I have a will to live. I feel like I had my birthday last week. It was September 7th. I was admitted because I was getting infusions of fluids. But I'm 54 years old. I wasn't expecting to deal with cancer at this age. And cancer doesn't care how old you are. It doesn't care how much money you have. Cancer doesn't care about anything. It doesn't matter how good you take care of yourself. It could show up at your door any day. And the difference is how you react to it. And I won't let it beat me. God forbid this isn't the end of it. I won't let it beat me. I will fight until I can't fight anymore. And I hope you feel the same way. I've never been a quitter. And my father was a Marine. He taught me never to quit. And they're watching over me. My mom and dad are watching over me. So I got a lot of help. Alright, 40 minutes. I gotta get out of here. We're out of gas sitting here. Alright, guys. God bless. I'll make my next video as soon as I can. Peace out.